Hair follicles are being collected in this study as a surrogate tissue for tumor. Hair follicle plucking is a minimally invasive procedure compared to the collection of a tumor biopsy. These samples will help us evaluate and confirm the expected biological responses to our experimental drug. The hair is made up of the shaft, the sheath, which contains multiple layers of epithelial cells, and the bulb, which contains the cells that regenerate the hair. There are 3 distinct phases of hair growth: anagen, catagen, and telogen. It is critical that the hair collected is in the correct phase of growth, that is, the anagen phase. Hairs in the anagen phase have a thick whitish sheath surrounding the lower end of the hair shaft, as well as a teardrop-shaped bulb at the root of the hair. Note that only hairs containing both the bulb and sheath should be collected. This is the follicle collection kit. It contains collection tubes pre-filled with lysis buffer, a tube rack, tweezers for plucking hair, fine tip forceps for transferring the hair into the collection tube, spring scissors for cutting off excess hair shaft, a magnifying glass, a -80 freezer storage box, and a hair follicle identification card. You will need to provide a vortex, gloves, Kim wipes, and 70% isopropyl alcohol. For this project, you will need to collect 20 hair follicles in the anagen stage and place them into the collection tube. Hair should be plucked one at a time. Have the patient sit in a comfortable position. It is most comfortable for the person collecting hair to sit or stand so that the patient's head is at approximately eye level. The preferred spot for collection of follicles is the area above the ear. Up to 85% of the follicles collected from this area are in anagen phase. Use the tweezers to grasp the base of one hair, 2 to 3 millimeters from the scalp. Align the tweezers with the direction of hair growth and pull in this direction. Pluck the hair in a short, sharp motion. Do not pull slowly. Do not pull against the grain of hair growth. Do not grasp the hair far from the scalp. Plucking incorrectly is more painful for the patient and will usually result in a broken, unusable hair follicle. It may be difficult to grasp only one hair if the patient has very fine hair. Attempt to select only one hair, but do not worry if you get 2 or 3 instead. Follicles are vascular structures. Occasionally you will see a tiny dot of blood at the site where the hair was just plucked. This is self-limiting and not a cause for concern. Correctly plucking the hair in a short, sharp motion will usually yield a complete follicle with an intact sheath and bulb. Once you have plucked the hair, evaluate it to see if it contains a complete follicle in the anagen stage. Check to make sure the bulb of the follicle is present. The teardrop-shaped bulb is usually easiest to see against a close white background. The bulb is black on black or brown hairs, but is white or clear in white and very light blonde hairs. It is important to note that each individual will have differences in sheath thickness and length. The hair follicle identification card included in your kit has several photographic examples. The guide also has a test area with a light and dark side that you can use to evaluate the hairs. Non-anagen hair should be discarded. Although anagen stage follicles can be seen with the naked eye, a magnifying glass has also been provided to make this process easier. Once the hair has been confirmed to be a complete anagen follicle with a sheath and bulb, transfer the hair from the plucking tweezers to the fine tip forceps by grasping the hair shaft. Be sure not to touch the sheath. Use the spring scissors to cut off the excess shaft so the complete hair sample can be submerged in the lysis buffer. The resulting hair should be approximately 10 to 15 millimeters. Deposit the follicle in the collection tube, being sure to submerge the samples completely in the liquid. Always use the fine tip forceps. Never transfer the hair into the collection tube using the plucking tweezers. The lysis buffer is irritating to the skin and you must not risk getting it onto the tweezers and subsequently onto the patient. Repeat this until you have collected 20 anagen follicles. Screw the cap on the tube and vortex for 60 seconds at max speed. Be sure the cap is on securely to prevent leaking of the buffer. Remove the tube from the vortex and tap it on the bench to submerge all of the hairs. Inverting the tube a couple of times, followed by tapping, can also help. Visually inspect and confirm all hair follicles are fully submerged in lysis buffer prior to capping. The fine-tip forceps can be used to fully push hairs into liquid. Keep the tube upright, place into the storage box, and store in a -80°C freezer. Make sure the sample is frozen upright before shipping so that the hair follicles are frozen within the lysis buffer. Please refer to your specific protocol regarding shipping instructions. Once you are adept at identifying anagen follicles, collection should proceed quickly. Collecting 20 follicles will normally take less than 10 minutes unless the patient has a very high percentage of non-anagen hairs or has easily broken hair. Remember to disinfect tweezers, forceps, and scissors between patients and at the end of every collection. Thank you for taking the time to watch this video. Data from the surrogate tissue will help us make informed decisions on the biological activity of the drug being studied.